Hey, everybody. Welcome back to the Migraine Mentors minicasts. We are your hosts, the Migraine Mentors. My name is Dr. Eric Reese, and I'm here with my brilliant co-host, Dr. Thompson Mayasaka. Thompson, why don't you tell everybody the temperature of the weather in Minnesota today, if you can?
Yeah, I currently -14. It feels like -26, which
Yes.
is went out sunbathing this morning. So I don't know if you can tell by my super pasty complexion, but I've just been soaking it up.
Yeah, a lot of vitamin D coming through the channels over here. So hopefully none of you are dealing with the temperature that we're dealing with today. But we are coming to you live not only because we think this is an important topic, but there's nothing else for us to do outside. So we may as well do something educational. Today's topic is something that's really important to us and it's really interesting to us because it's actually been one of the secret sauces that we've brought to the table clinically. And Thompson, you've been passionate about this since the moment I met you, talking about migraine symptoms and how you're managing patients. But it really encompasses this whole conversation about your habits, your diet, your nutrition, and it comes down to your metabolic health. I'm sure some of you have heard the latest conversations with RFK and his Make America Healthy Again conversations about metabolic health, what this looks like, what Callie and Casey means are discussing as well too. And we're really bringing this to the clinical forefront with patients. So, really, maybe it's easier for us to break down. Thompson, maybe this is a good question for you. Like, what is metabolic health? And why is this so important for patients who struggle with migraine attacks?
Right, that's a great question to clarify initially. If you've ever read Peter Attia's book, Outlive, I think he does a really good job of packaging it in a way that you understand it. And I think the best way of looking at it is, does what you eat ultimately get fully stored, or do you not store enough of it and it just swims around in your bloodstream? So when you eat a sandwich, a breakfast sandwich, and you digest it, where do the fats go? Where do the carbohydrates go? Do they get stored completely? Or do some of them end up freely circulating in your blood, which is essentially what diabetes is, or dyslipidemia if you don't store and manufacture all of your fats effectively? That's the easiest way that I have heard it described. Um, Basically, how fatty and sugary is your blood? How do you describe it to patients, Eric?
I've never had a patient specifically ask me that question, but I think along your lines, I look at efficiency. I look at how efficient are you at utilizing the foods that you put in your body. So how good are you at absorbing fats and using them and putting them into cell walls and storing fat? I mean, fat's not inherently a bad thing. It's just too much of it is a really bad thing. There's a very big difference between, healthy fat and like pro-inflammatory fat. But the same thing is true for proteins, right? We know protein, if you have too much protein, you can, increase your blood glucose levels. So how are you utilizing proteins? Are they going to muscle after workouts or are they staying in your blood like you had mentioned? And then carbohydrates. I mean, blood glucose is a really big factor and a big deal for all of us. How are you utilizing blood sugars? So I think it's about efficiency for me. And what are your cells doing and not doing? And that's not something that you can just look at somebody and say, oh, I can tell. But you kind of can't, right? Like based on body image, based on how their skin looks, based on how they're communicating, do they look like they're having enough energy and kind of enough thought process to talk to you? So I'll base things off of that, but I would really look at it from a standpoint of how efficient are you at doing the things your brain and body need to do. And I think most patients would kind of agree with that based off of their symptoms and what they are or not able to do throughout the day.
Right. I think that's a great way of looking at it too. Um, when do you have that talk with people? When does it come up? Like what are some clinical triggers that let you know, okay, we got to have the metabolism talk with somebody? Like when does it hold people back?
Yeah, it all depends. And I struggle with this because in some cases, I feel like I really need to do everything at once with patients. And you've had those patients before because we've talked about this in the clinic about where you're like, they're a metabolic mess. They need to do X, Y, and Z. They also need structural care. They need visual rehabilitation. They also just need to like optimize their sleep. And that is like a massive checklist to take down. I think most of the time when I recognize these things, I will usually ask people a couple probing questions after I look at their history and their intake. So I'll see if they have any previous diagnoses. But I'll ask them and say, Are you somebody who gets hangry? Most people will tell you whether or not they're in that category. And I used to be there years ago before I started fasting and really looking at metabolic health. If they get hangry, there's probably a high chance they have some sort of dysglycemia or issues with blood sugar, and or they're dealing with some sort of metabolic dysfunction. I'll ask them about their sleep. So how do you feel in the morning when you get up? You can have a 5 minute window of like where your brain is slowly waking up, but after that, you should be ready to rock and roll. And if you're not, then there's probably something going on metabolically that is limiting your capacity to really get where you need to be. And then I think that the last thing too is I'll just ask them and be like, well, how's your digestion and how are your, bowel and bladder function? Not fun, fancy things to talk about like on the first time meeting somebody, but really, really important. And when I set that precedent, people are like, okay, I'm open to like having these discussions. But when I find out those underlying issues and I match them with the other two questions, I can usually pretty confidently say, hey, here's the issue. We can run blood after that. Or I just say, listen, let's just own your habits and see if we can change things that way. So any comments or any thought processes on that you would add to it?
I love how you phrase that end part, own your habits. I think when you break these complex collection of activities into just simple one-off habits and just work through those over time, that's how I've found the really permanent change happen. That's a strategy that anybody can implement regardless of how busy you are, because we've all had the patients that come in and they look at you and basically grab you by the shirt and say, just tell me what to do and
Mm-hmm.
I'll freaking do it. Not everyone's like that. So, a lot of people have life responsibilities. Like the last patient I had before I hopped on here as a 3-month-old kid. So a lot of the things that we're trying to work on him with are limited by the fact that he's not sleeping well and he's kind of just eating whatever his wife cooks. And, he's going to work and pretty much burning all of his energy. So we have to be really pragmatic and realistic about what we try and install into that, busy person's life. And I love doing the habit approach that way is, you just see somebody over time, you just hyper focus on one thing until that's completely integrated into their life. And that's how you get people better, 5 years from now. And I know you and I talk about that a lot of, I'm not necessarily interested in how you're going to do in 3 months, although that's important to me. I want you to feel better and be better 3, 5, 10 years from now. And in my experience, it's a lot easier to achieve those goals if you just focus and, like, as you say, own your habits.
I think a big part of that too is just setting expectations and like setting the table early on with that to say, here's what I expect over the next couple of days. Here's what I expect over the next couple of weeks. Here's what I expect over the next couple of months. And then here's what I would hope to have happen over the next couple of years. And when people kind of look at it from that standpoint, it's no longer like, oh, I have a New Year's resolution, 30-day goal kind of deadline, right? That's a lot of pressure emotionally. And then also
Mhm.
just changing your brain in general. It's possible. There are people, we get patients all the time who are like, listen, I'm ready to do this. I'm ready to throw down. I'm all in. Like, I am sick of being sick. I'm tired of being tired. Like, I can't handle this anymore. And we have protocols for that. But for the majority of people who are probably listening or just out there, and know that that's not always like something that's a really good, way to go. Right. So, I think furthermore with that too, when we're talking about metabolic health, it really is a yes and conversation, right? So I think one of the biggest factors is getting your blood sugar stable and getting that balanced. We've written about this ad nauseum. We've talked about it. You've put up some great TikToks and blog posts about it too. And once you kind of start like peeling back those layers of the onion, it's just like one more layer, one more layer, one more layer, right? So once we get some of the things stable, we look at your habits, we look at the foods you're eating, then we start playing with stuff. If I have to, I'll order blood. I like data. I think patients do too. But I don't want to spend hundreds of dollars on labs when I'd much rather have you spend hundreds of dollars on food that's going to help you and get you with the results, not just telling me that you have an issue. So there's kind of a happy medium there. And Thompson, I know you walk that fine line quite often as well too. What else would you add to that?
I mean, not much. Right as you were saying that, my mind goes back to one of our previous episodes. You were talking about a patient that was eating fast food most days of the week, and you clean that up, and she had her first time where she didn't run through her Imitrex in like
Yeah,
9 days.
yeah,
Is that right?
yeah, yeah. She was taking. She would crush 9 Imitrex in 10 days, like the first 10 days that she could even have her prescription, and then she would be stuck for the next like 3 weeks because you can only get 9 per month, right? And yeah, she sent an email right after New Year's and was like, "Hey, I've only used one Imitrex in the last 30 days." And I was like, that is insane. But also, too, good on you, right? Like, because she's completely owned that. And so those small steps and those small habits can be massive in the outcomes that people achieve. And I know you've had a lot of patients like that too. You had a great case that came through recently as well, where why don't you just maybe elaborate on that and about the just the changes she made and what she's seeing now too? Because that was really cool.
Yeah, absolutely. That was very similar, actually. So she was having migraines about 20 to 25 days a month, and then got in 3 car accidents in 3 consecutive months and started getting a migraine every day right around between 10 and noon. And so she would take the meds. Sometimes it would work, sometimes it would not. And then when it didn't work, she worked remotely. So she would just set her out of office on, take a nap, and hopefully wake up ready to work again. And that was just her life for 4 or 5 years. And just no way to fly, man. And so when I met her, she was one of those patients that I could tell immediately. It's like, you're going to do anything I say. So I'm going to give you all the right information. Immediately told her about histamine and how people with migraine lack an enzyme that breaks that down, and it makes things pulse more and it makes it hurt more. And as soon as she heard that word of like, show me the foods that have histamine, and I swear to God, I will not eat a single one. And she did. She was completely committed, hook, line, and sinker to that, and immediately cut her frequency down. She started having them about every other day, and they would slowly get progressively later into the day. We worked a few different things with blood sugar, but mostly just cut out histamine, put her on a supplement that contains all of the researched ingredients that are shown to abort migraines, and did the rehab for the concussion, and she's having 1 or 2 a month now.
So badass. That's awesome.
It's awesome. I love hearing those stories, because for all those people out there that are in the boat that thinking they'll never get better, like, stuff happens all the time. All you need is just a little bit of information and you're off.
And well, I think to your point too as well, 2 cases that came to our clinic, relatively similar presentations, they both needed different treatment plans, right? I think that's the
100%.
hardest part about this is we have told with trying to set a way to be like, listen, this is the protocol. This is like the standard. This is the way to do it. And we just haven't found a way to do it. And I don't think we ever will. I think that you've been sold a false bill of goods if you think it's in one pill, one surgery, one therapy, one type of professional, whether it's a medical doctor or a chiro or a PT or a nutritionist. Like, you've been sold a false bill of goods. You have to understand it is always going to be a yes and conversation, and it's going to be something where you have to put in the work, but you will get the results and the benefits for that long term. And everyone has growing pains regardless of what those growing pains are being triggered by, and that's a great example of the brain and the body are so resilient when you give them the right dose of the right medicines in the right way. And I think that that's really powerful for so many people. So we're out of time. Thompson, was there anything that you want to leave people with as we continue to close this out?
I would reinforce the fact that there's a study that looked at the things that make the aspects of events that make them stressful. So specific to migraine or really anything, unpredictability is the number one thing. So if some big bad thing happens to you completely out of the blue, that's extremely stressful. And 2, a sense that you don't really have control over it is another thing. So same thing. If you have this big accident that happens completely out of nowhere and you didn't have any control over it, that's incredibly stressful. So what we're describing to you in crafting these lifestyle and habit modifications is it's really de-escalating the amount of stress that migraine is going to have on your life, because having all of these tools that you yourself are doing consistently and getting that self-efficacy that you can manage migraine on your own is a fantastic way to feel as if you are in control of it, which in turn makes you less stressed over time. Because once you have that feeling of, I had a migraine come on and I made it go away with things that I did myself, that is a complete paradigm shift in how you manage it. And I think it can go a very, very long way in helping it become more manageable. So I would really open yourself up to the idea that, yes, the medications are probably going to help some amount, but ultimately the things that are really going to allow you to manage it on your own are ultimately things that you do on your own. And that at first may sound like kind of a hard thing, but in the long run is an absolutely beautiful thing that we've seen people truly spread their wings and manage this stuff on their own completely.
It's powerful. Yeah, I have full conviction that when people own their health, they completely give themselves freedom and autonomy. I think that's what everybody's truly looking for. So This is another great episode with the Migraine Mentors minicast. Thank you for joining us. For those of you who are subscribers to our newsletter, thank you so much for supporting us. For those of you who aren't, you should become a subscriber for our newsletter. We're giving this content every single week in digital format, audio format, video format. We're trying to be appealing to all audiences. So go ahead and subscribe to the link in our bio, and we hope to see you at the next episode.